Hi everyone, welcome to the new video in pharmacology, and in this video again I'm taking an important question which is asked, which is the clinical significance of plasma protein binding. Now plasma protein binding, we all know it is a part of the pharmacokinetic, the feature which is the distribution. It's a part of that. So many a times in the exams, what I've seen, students tend to write about plasma protein binding, yes, but they miss out the clinical significance when this post. And everything now is being connected to clinical significances in pharma. So you relate whatever concepts you're learning in pharmacology to what actually, why do you want to know this? Why do you want to learn this? Because it has some clinical significance. So what the examiner actually wants you to answer in this question is the clinical importance of plasma protein binding. How will it help you clinically? अगर आपको plasma protein binding के बारे में पता है, क्यों पता होना चाहिए आपको, क्या significance है, that is what you're supposed to write here. So here I'm going to enumerate the points which you're supposed to answer when you are going to answer about this particular question, clinical significance of plasma protein binding. So let's get into it. And this is Dr. Deepika Tikku from Simply Pharmacology. And as every time I come up with either a new video on some topic or a related question which is usually asked in exam, so that you can benefit from that and take notes, and next time when you attempt any question like this, it will be really easy for you. Alright. So what is plasma protein binding? So नाम से ही पता लगता है plasma protein से bind करना. That is plasma protein binding. What binds to the plasma protein? That is your drug. The drugs bind to the plasma protein. And which plasma protein? Do you need to know about all the plasma proteins? No. The two important plasma proteins which you should know are number 1 albumin and number 2 alpha 1 acid glycoprotein. Okay? And this is because the acidic drugs, they bind more to the albumin. The basic drugs bind more to the alpha 1 glycoprotein. Now, what happens when the drugs bind? Why should we know about it? And I want to tell you here, let's take this color. See, when you are giving a drug to the person, so after it has passed into the systemic circulation, जिसको हम कहते हैं absorption. So once absorption हो जाती है, that means in the systemic circulation में आपकी drug चली गई, तो एक्शन तो उसको प्रोड्यूस करना है बाय व्हेन इट रीचेस अ पर्टिकुलर ऑर्गन, उसके सेल्स में पहुंचेगा, देन ओनली इट विल परफॉर्म इट्स एक्शंस. सो फ्रॉम द ब्लड इट हैज टू डिस्ट्रीब्यूट इनटू द वेरियस टिश्यूज. नाउ दैट प्रोसेस इज कॉल्ड एज डिस्ट्रीब्यूशन. एंड हाउ इट इज गोइंग टू गो टू द वेरियस टिश्यूज? थ्रू द ब्लड, डेफिनेटली. एंड देन देयर आर सर्टेन प्रोटीन्स which are present in the plasma which can help in, like, which get bound to these drugs. Now, what are the consequences here? So this is absorption leading to distribution. So here if I say this is your blood vessel, right? And let's say we have a drug here. This is the drug that you're given. And there are plasma proteins present. So which color? Let me take this color. Okay, so these are the plasma proteins. So some of the drugs will bind to this plasma protein, उसके साथ bind कर जाएंगे, ठीक है? Let's say here, or some portion of the drug will be free. So what you see here, this is the free form and this is the bound form of the drug. Now, for this drug to pass through the endothelium and for that to enter into the cell, ये cell है, इसके अंदर enter करना है. So पहले इसको एंडोथीलियम के थ्रू पास करना है, फिर सेल मेम्ब्रेन के थ्रू भी पास करना है. So obviously it has to be first highly lipid soluble. Secondly, the size should be adequate. अगर वो lipid soluble नहीं है, at least pores के थ्रू भी जा रहे हैं, तो that size should be that much कि वो pores के थ्रू अंदर जा सके. So जब bound form of drug होती है, this one, the bound form here, this is a bigger size molecule and it cannot pass through this endothelium or the cell membrane. So it remains in the blood, in the plasma. While this free form, and again depends whether it is highly lipid soluble or not. अगर highly lipid soluble तो ज़्यादा से ज़्यादा drug ऐसे easily pass कर जाएगी. अगर कम lipid soluble है तो कम pass करेगी. That's another aspect, ठीक है? has to go through. So this free form can easily go as compared to the bound form. छोटा drug है, छोटा molecule, it can easily pass. बड़ा molecule है, it is difficult to pass. So इसलिए जो free form है, जब ये सेल के अंदर पास कर जाएगी तो एक्शन प्रोड्यूस करेगी. So therefore the action which is produced is because of the free form, while bound form it only acts as a reservoir. वहाँ पे वो बस है उधर वो ड्रग, एक्शन प्रोड्यूस नहीं कर रही है. और नॉर्मली क्या होता है, आपका जो फ्री फॉर्म और बाउंड फॉर्म होता है दैट इज एन इक्विलिब्रियम. सो दैट मीन्स अब ये ड्रग फ्री फॉर्म है, इट विल गो इन टू द सेल, प्रोड्यूस द एक्शन, देन देयर विल बी मेटाबॉलिज्म, एक्सक्रीशन. सो ये फ्री फॉर्म चला गया. सो फ्री फॉर्म का लेवल हो गया कम. सो उसको कॉम्पेंसेट करने के लिए मोर ऑफ द बाउंड फॉर्म विल गो इन टू द फ्री फॉर्म. सो और ये वाली ड्रग है ये फ्री हो जाएगी. सो ऐसे करते धीरे 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 सारी ड्रग गोज इन टू द cell, produces action, gets metabolized and then out of the body. So bound form actually is like a reservoir. So some drugs which are highly bound, they will gradually धीरे धीरे वो bound से free में आएंगी, तो they will stay in the body for a longer period of time. और कुछ ऐसी drugs होती हैं जो bound बहुत कम होती हैं, maximum वो free रहती हैं, तो वो फटाफट से cell में जाएंगी, action produce करेंगी and they will be out of the body. So that is an aspect, like the time, the half-life or duration of action, it's dependent on whether more of the drug is in the free form or the bound form. So this is the concept of what is plasma protein binding. और क्यों हमें पता होना चाहिए, because इससे हम predict कर सकते हैं कि drug कितनी जाएगी, जल्दी जाएगी, लेट जाएगी, longer duration है कि short duration है. That's just one aspect. So let's now come and see what are the clinical significance of plasma protein binding. Why should a doctor know about it, or why is the knowledge important? ठीक है. Now the clinical significance, there are actually 5 major. One is duration of action, I just told you about it. You can predict the duration of action of the drug. Number 2, the distribution, whether the drug distributes or not depends on plasma protein binding. Number 3 is dialysability. Number 4 are the diseases which can affect the plasma protein levels, and number 5 are your displacement reactions. So I will go through them one by one and tell you what each of these factors do, or what are the importance of each of these factors. Coming to the duration of action. So I've already told you, when the drug is most in the bound form, it has more increased rather duration of action. और अगर किसी का free form ज़्यादा है तो वो fast action होएगा और जल्दी निकल जाएगी body से. So there will be decrease in the duration of action. So you can say that this drug is longer acting because of this. This is one of the factors in certain drugs which are longer acting. One of the factors. ये क्यों longer acting है, इसका bound form ज़्यादा है. So धीरे धीरे ये plasma protein से dissociate होंगी, free बनेंगी, and then they'll enter into the cells and they'll produce their effect. So one important parameter is you can predict the duration of action of the drug. The second significance is distribution. So remember, your volume of distribution is always inversely proportional to the plasma protein binding, or plasma concentration. जैसे plasma concentration inversely proportional to the plasma concentration, which means, again, if I see here that this is the drug and these are the plasma proteins, ठीक है. So the ones which are bound to the plasma proteins, they will not enter into the cell. I already told you, वो cell के अंदर नहीं जाएंगी. और distribution का मतलब क्या है? They have to go into the cell, distribute होना है उन्होंने cells में, अपना action produce करना है. तो drugs which are highly plasma protein bound, that means they are more in the plasma में ज़्यादा है, उनका concentration plasma में ज़्यादा है, because they are bound to the plasma proteins, so they are staying in the plasma proteins. So drugs which are highly plasma protein bound, so increase in the plasma protein binding will mean there is less amount of volume of distribution. और अगर free form ज़्यादा है drug का, bound कम है, so obviously more of the drug is going to enter into the cells. So if there is less plasma protein binding, तो plasma में वो drug कम है, इसका मतलब कहाँ चली गई है? Distribute हो गई हैं. So they've gone into the tissue, means increase in the volume of distribution. So you can predict that drugs are highly plasma protein bound, दे विल टेक लॉन्ग टू गो इन टू द टिश्यूज, ठीक है, तो डिस्ट्रीब्यूशन उनकी स्लो है, कम है, और जो ड्रग्स लेस है प्लाज्मा प्रोटीन बाउंड उनकी डिस्ट्रीब्यूशन थोड़ी ज़्यादा है. सो इट्स इनवर्स रिलेशनशिप. नंबर थर्ड इज डायलाइजेबिलिटी. व्हाट डू यू मीन बाय डायलाइजेबिलिटी? कि वो ड्रग डायलिसिस से रिमूव हो सकती है कि नहीं हो सकती है. एंड आई विल गिव यू एन एग्जाम्पल हियर. सो लेट्स से दिस इज योर ब्लड वेसल, ठीक है, एंड दिस इज योर ड्रग हियर, and these are the plasma proteins. Some amount is bound, some amount is free. Let's say now patient को toxicity हो गई है of the drug, high dose ले ली है, toxicity हो गई है now, या poisoning हो गई है. तो poisoning में the main aim is to remove the poison from the body. So whether you remove it by gastric lavage, whether you remove it by urinary excretion, or you can remove it through the blood, plasma से उसको हटा दो ड्रग को by process called as hemodialysis. And in that hemodialysis, what happens? Here, if I hope this works. So this is like a tube is passed here. ऐसे ट्यूब जाती है. तो ये क्या करती है? ये प्लाज्मा में से इस ड्रग को बाहर निकालेगी, ठीक है. सो ये जो ड्रग मॉलिक्यूल्स हैं जिनकी टॉक्सिसिटी हुई है, दे विल बी रिमूव्ड एंड द पेशेंट कैन बी क्योर्ड. अगेन नाउ कम्स वेदर विच टाइप ऑफ ड्रग विल बी रिमूव्ड, फ्री फॉर्म की बाउंड फॉर्म. एज आई टोल्ड यू, ये बड़े मॉलिक्यूल्स हैं, दे फाइंड इट डिफिकल्ट टू एंटर थ्रू दिस ट्यूबिंग और थ्रू द प्रोसेस. सो ड्रग्स विच आर हाईली प्लाज्मा प्रोटीन बाउंड, they cannot be removed by dialysis. So do not do dialysis for poisoning because of these drugs. It will be futile. Only the free form can enter, smaller size. It is easier to remove these drugs by hemodialysis. तो ऐसी drugs जो जहाँ पे dialysis नहीं करनी चाहिए, वो drugs होती हैं जो highly plasma protein bound drugs होती हैं. And here I would like to give you a mnemonic to remember कि कौन सी ड्रग्स में हमें डायलिसिस अवॉइड करना चाहिए. सो यू रिमेंबर अ निमोनिक कॉल्ड एज अवॉइड डायलिसिस. सो ए स्टैंड्स फॉर एम्फेटामीन्स, वी स्टैंड्स फॉर विरापामिल, ओ स्टैंड्स फॉर ओपियोइड्स, आई स्टैंड्स फॉर इमीप्रामीन, and D stands for digoxin. So avoid dialysis in such drugs. They cannot be removed by dialysis as such. This is for you to remember. All right. Let's go to the fourth point, which is diseases. Now, what I mean by diseases is there are certain diseases which will influence the levels of plasma proteins in the blood. For example, अगर liver disease है किसी को, तो albumin level उनमें कम हो जाएंगे. और albumin क्या कर रहा था? So ये आपका अगर albumin है, इसके ऊपर ड्रग्स बाइंड है, करी हुई हैं, पर अब एल्ब्यूमिन लेवल कम हो गए हैं तो बाउंड फॉर्म ड्रग का कम हो जाएगा, ठीक है. बिकॉज ऑफ डिक्रीज एल्ब्यूमिन क्या होएगा? द बाउंड फॉर्म विल बी लेस, द फ्री फॉर्म विल बी मोर बिकॉज एल्ब्यूमिन इज लेस. सो व्हाट हैपन्स व्हेन द फ्री फॉर्म इज मोर? एक्शन इज मोर बट even the toxicity can occur because you are giving the same amount of drug even when the albumin is low. तो ज़्यादा फ्री अमाउंट हमने दे दिया है, ज़्यादा फ्रीडम दे देते हैं तो गड़बड़ हो जाती है, ठीक है. तो क्या गड़बड़ हो जाती है कि टॉक्सिसिटी होनी शुरू हो सकती है उसी ड्रग से. सो देयरफॉर व्हेन यू आर गिविंग अ ड्रग व्हिच इज you know that it binds to albumin in patient of liver disease, you should always decrease the dose of the drug because you know that now the albumin is low. You don't have, if you give high same amount of dose पहले वही दोगे तो toxicity chances होंगे. तो इसलिए keeping in mind the level of albumin in the blood, in the plasma, we have to decrease the dose of the drug. So that is one thing. Then there are other diseases, for example myocardial infarction and Crohn's disease. इसमें there can be increase in the alpha 1 acid glycoprotein. और यहाँ पे क्या होगा? अब जो बेसिक ड्रग्स हैं वो ज़्यादा बाइंड करेंगी. सो लेट्स से यही ड्रग है बेसिक, ठीक है, और ये हमारा लेट्स से दीज आर दी अल्फा 1. सो मोर बाइंडिंग अकर्स. सो व्हेन मोर बाइंडिंग अकर्स दैट मीन्स द फ्री फॉर्म इज लेस. फ्री फॉर्म लेस हो गया, एक्शन कम हो गया. तो इसमें हमें क्या करना चाहिए? वी नीड टू इंक्रीज द डोज. बिकॉज ज़्यादा बाइंड हो रही है, फ्री कम है, तो हमें फ्री ज़्यादा करने के लिए डोज बढ़ानी पड़ेगी. सो दिस इज द इंपॉर्टेंस ऑफ नोइंग अबाउट द वेरियस डिजीजेज विच कैन इन्फ्लुएंस द लेवल ऑफ प्लाज्मा प्रोटीन्स. राइट? नाउ द लास्ट important point to know in this is are your displacement reactions, and they're clinically useful in only few drugs जहाँ पे we know that they're highly plasma protein. हर एक के बारे में we don't have to remember this because there are certain other factors. It's not practical to remember about each and every, but there are few examples which you should know because they are highly plasma protein bound. और अगर वो ज़रा सा भी बॉडी में उनकी फ्री लेवल्स बढ़ जाते हैं बाय सम रीजन, तो दैट कैन लीड टू डेंजरस emergencies or dangerous toxicities. So one classic example of such a drug is your warfarin. एंटीकोगुलेंट है, ठीक है, ओरल एंटीकोगुलेंट है. अब क्या होता है जब पेशेंट को हम वॉरफरिन देते हैं, बिकॉज इट्स एन एंटीकोगुलेंट, मे बी आफ्टर स्ट्रोक और स्ट्रोक के बारे में बाद में दे दिया है, and we don't, because coagulation हो रही है, we don't want the arteries or blood vessels or any to be clotted so that they don't have any kind of issues again, whether it's in the heart or in the brain. So we give drugs like warfarin to them. Now warfarin is one drug which is 99% bound to the plasma protein. मतलब ये ज़्यादातर बाउंड ही रहती है, ठीक है. This is your warfarin, this is the plasma protein. So let's say this is 99% यहाँ पे है. So yeah, 99 molecules for easier understanding हम याद करते हैं. 99 molecules bind रहते हैं. अगर आप 100 molecules 100 milligrams, तो 99 bind रहता है और only 1 molecule is free. और ये हमें एक्शन देता है जो हमें चाहिए ऑफ एंटीकोगुलेंट, और ये डोज हमारे को सूट करती है. दैट इज द डोज विच वी गिव द पेशेंट एंड ही इज फाइन ऑन दिस. नाउ इफ यू गिव दिस ड्रग with another drug, for example salicylate, जिसमें aspirin के साथ दे दिया. Now aspirin also has an affinity for this particular plasma protein. What it will do, it will try to displace warfarin from here. So क्या हुआ? aspirin खुद लग गया इधर, और जो warfarin पहले सिंगल था इधर which was doing this one, and ये डबल हो गया, ठीक है. So because of this displacement reaction, now there are 2 free molecules here. So यहाँ पे 1 था, यहाँ पे 2 है, so the action is 2 times. So the action क्या है इसका? Anticoagulant effect. So the anticoagulant effect is doubled. And what can happen? The patient can bleed to death. Internal bleeding शुरू हो जाएंगी. So because it has such a narrow margin, excuse me, narrow safety margin also. So for such drugs it is very important to see कि हम इसको किस ड्रग के साथ दे रहे हैं, and we have to monitor the dosage. तो in case में, because lot of times aspirin is an antiplatelet, can be given, what you do is you just decrease the dose of warfarin. Simple, ठीक है. So you just decrease the dose of warfarin so that उसका anticoagulant action dominate नहीं करता. And obviously when you're giving warfarin in patients, you never give warfarin without periodically checking on the INRs. तो INRs होना चाहिए 2 to 3 के बीच में, और आप बार बार warfarin का levels इसी तरह हम check करते हैं, and you adjust the dose accordingly. So that also needs to be done along. So we don't only depend on this. Practically laboratory में भी जाके हम अपने we do all those tests and look for ourselves. And if the INR is within 2 to 3, that means that you're giving the correct amount of drug. When you give less amount of drug, there will be no action. When you give more amount of drug, then there will be toxicity, which is bleeding. So all these are the important points. So whenever you are asked to write about the clinical significance of plasma protein bindings, please do not just say that plasma protein binding only means that many of the students only write yes, long duration of action. That's known to many. That is not the only significance of plasma protein binding. Plasma protein binding has all these significances, starting from the duration of action, going to the distribution where it is inversely proportional. Third is the dialysability. Highly bound drugs, जो highly bound particles होते हैं वो dialyze नहीं हो सकते. They cannot be removed by hemodialysis. Only the free form can be removed by hemodialysis. So this is the mnemonic to remember which drugs are not. This is like avoid dialysis. Avoid dialysis in these drugs because they cannot be removed by dialysis. Diseases which affect the levels of plasma proteins in the body. And last but not the least are your displacement reactions. Important only for certain drugs, very few drugs which are highly plasma protein bound. Not for each and every drug it is important, right? So with this we come to the end of this video. I hope you've liked the video, and if you have liked the video, please be kind enough to subscribe if not already done, and put your comments, and if you find such questions, answer to the question kind of videos important and helpful. So see you in the next video. Thank you so much.